Hey, future nurses, if you're prepping for the NCLEX and need hypoparathyroidism to finally click, you're in the right place. Let's break it down so you can remember it on test day and for real-life patient care. So, what is hypoparathyroidism? It's a rare disorder where the parathyroid glands don't make enough parathyroid hormone, or PTH. That's a big deal because PTH helps regulate calcium and phosphorus in your blood. When you're low on PTH, your calcium drops and your phosphorus goes up. How does this show up in patients? Think low calcium or hypocalcemia. I always remember the classic symptoms: muscle cramps and spasms called tetany, plus tingling in the lips, fingers and toes. It can get serious: seizures, heart rhythm problems, even psychiatric symptoms like anxiety and depression. Chronic cases can even lead to cataracts or dental problems. If you see these on a test question, think hypoparathyroidism. Now, treatment. The gold standard is conventional therapy, daily oral calcium supplements and active vitamin D analogs like calcitriol. The goal? Keep calcium in the low normal range, calm those symptoms and avoid complications like kidney stones or abnormal calcium deposits. But here's the catch: too much calcium can be just as dangerous, so monitoring is key. I'm talking regular checks of serum calcium, phosphorus, creatinine and urinary calcium, especially when you're adjusting doses. Once you're stable, monitoring goes down to twice a year. Oh, and don't forget the diet. Plenty of calcium-rich foods like dairy and leafy greens, but watch out for high phosphorus stuff like colas or processed foods. For some patients, conventional therapy just isn't enough. That's where PTH replacement therapy comes in. Recombinant human PTH or rhPTH 184 is now an option, especially if symptoms aren't controlled. It started as a daily injection, with careful dose changes based on calcium levels, and needs to be tapered off slowly if it's stopped. New therapies are in the works too, so keep an eye out for names like TransCon PTH in future NCLEX questions. Remember, hypoparathyroidism is usually chronic, so lifelong management is the name of the game. Watch for complications, think kidney, heart and neuro symptoms. And for surgical cases, if low PTH lasts more than a year, it's considered permanent. Here's what you need to know for the NCLEX. Recognize signs of hypocalcemia, know the mainstays of treatment, remember to monitor labs, and don't skip those dietary recommendations. That's hypoparathyroidism, exam ready and crystal clear. For more info, check out www.brispainternational.com. Good luck and go ace that NCLEX.